Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. The 7 vaccines all grandparents should get. Though anyone can get the flu and other infectious diseases, older adults are at an increased risk of severe illness if they do. If you are 65 or older, getting vaccinated is one of the best ways to protect yourself, and your families, from preventable infections. /r/n/r/n7 vaccines are part of the vaccination schedules of most older adults. If you haven't had them, or are unsure if you are up to date, speak with your healthcare provider. /r/n/r/n/Tdap Zovoilis, Getty Images /r/n/r/n in the United States. An estimated 12,000 to 52,000 people die every year from flu-related causes. Hundreds of thousands have been hospitalized from this ever-evolving respiratory infection. /r/n/r/n older adults are at the highest risk for developing severe illness and death from the flu. According to the Centers for Disease Control and Prevention, CDC, between 70% and 85% of flu-related deaths are in adults 65 and over. Between 50% to 70% of flu-related hospitalizations occur in this age group. /r/n/r/n The CDC advises people 65 and over to get a flu shot annually rather than thenasal flu vaccine. The CDC also recommends those 65 years and older get one of the following 3 higher-dose or adjuvanted flu vaccines: /r/n/r/n Grandparents need to get the flu shot not just to protect themselves but also the youngest members of their families. Until babies receive their first dose at 6 months, they are extremely vulnerable to flu complications. /r/n/r/n If you have a grandchild on the way, your healthcare provider may advise you to get the Tdap vaccine if you did not receive the vaccine as an adolescent. The vaccine protects against 3 diseases: tetanus, diphtheria, and pertussis, whooping cough. /r/n/r/n Protecting yourself against pertussis is especially important, as it can be passed to newborns in whom the infection is often serious. Between 2000 and 2017, 84% of deaths from pertussis were in infants younger than 2 months of age. /r/n/r/n Even if you have no grandchildren, the CDC recommends that everyone get the Tdap or TD, tetanusdiphtheria, booster dose every 10 years. /r/n/r/n There are 2 Tdap vaccines approved for use in the United States: /r/n/r/n Of the 2, Boostrix is the only one approved for ages 65 and over. /r/n/r/n While pertussis is often passed from adults to young children, pneumococcus, a bacterium that can cause pneumonia, meningitis, encephalitis, and other severe illnesses, can often be passed from children to older adults. /r/n/r/n In children, pneumococcus generally causes mild illnesses like ear infections. But, in older adults, pneumococcus is a leading cause of pneumonia, which is more likely to cause death the older you are. /r/n/r/n According to the CDC, the risk of death from pneumonia in people 75 to 84 is 3 times that of people 65 to 74. In people 85 and over, the risk increases by over 10-fold compared to the 65 to 74 age group. /r/n/r/n There are 4 pneumococcal vaccines approved for use in the US, however, only 3 are recommended for older adults. /r/n/r/n If you are 50 or over, you should also talk to your healthcare provider about getting the shingles vaccine. This is true even if you've already had shingles, aka herpes zoster, in the past. /r/n/r/n Shingles is a viral infection that causes a painful, blistering rash. It rarely causes death, but it can lead to serious complications, including postherpetic neuropathic pain and herpes zoster ophthalmicus. Older adults and those who are immunocompromised are more likely to be hospitalized for shingles. /r/n/r/n You can't give shingles to your grandchildren. However, if your grandchildren haven't had chickenpox or been vaccinated against chickenpox, you can give them chickenpox if you have active shingles. /r/n/r/n Shingles is caused by the same virus that causes chickenpox, varicella zoster virus. When you are infected with chickenpox, which almost everyone born before 1980 has been, the virus stays dormant in your body and can reactivate later in life to cause shingles. /r/n/r/n There is only shingles vaccine approved for use in the United States, Shingrix. Shingrix is a recombinant vaccine recommended for adults 50 and older. It's given in 2 separate injections 2 to 6 months apart. /r/n/r/n Zovoilis, a live vaccine previously recommended for shingles prevention, has been discontinued in the United States as of November 18, 2020. /r/n/r/n Even if you have gotten the Zovoilis vaccine in the past, you should still get the Shingrix vaccine. /r/n/r/n It's recommended that those ages 19 to 64 years of age who were born in 1957 or later with no evidence of immunity to measles, mumps, or rubella, receive 1 to 2 doses of the MMR vaccine. /r/n/r/n Measles used to be common in the United States until the measles vaccine became widely available. Through mass vaccination campaigns, measles outbreaks became increasingly rare, and the disease was officially declared eliminated in the US in 2000. /r/n/r/n With that said, the spread of anti-vaccination, anti-vaxxing messages has led to a decline in the use of the MMR, measles, mump, and rubella vaccine. As a result, measles made a big comeback. /r/n/r/n Older adults are more likely to experience serious complications if they do get measles. According to the CDC, 1 in 5 unvaccinated people born in 1957 or later will be hospitalized if they get measles, particularly those with weakened immune systems. /r/n/r/n The CDC recommends vaccination for anyone born in 1957 or later with no evidence of immunity to measles, mumps, or rubella. For these adults, the CDC recommends 1 or 2 doses, at least 4 weeks apart. /r/n/r/n Vaccination is advised for all people 6 months and over. Although younger children are far less likely to develop severe symptoms if infected, that shouldn't suggest that they are inherently safe from COVID-19. While many will have mild or no symptoms, some babies and younger children do end up in the hospital. This is especially true for children with asthma, diabetes, and congenital heart disease, among other pre-existing conditions. /r/n/r/n There are 3 COVID-19 vaccines available in the United States. Each is delivered by intramuscular injection. The Food and Drug Administration, FDA, has authorized or approved the following COVID-19 vaccines: /r/n/r/n Everyone ages 6 months and older should stay up to date with COVID-19 vaccines as new COVID variants emerge. /r/n/r/n Respiratory syncytial virus, RSV, is a highly contagious virus that usually causes only mild cold symptoms in healthy people. However, it's especially dangerous for young infants and older adults, particularly those with chronic health conditions or a weakened immune system. /r/n/r/n The CDC recommends that all adults over age 75 receive a one-time vaccination to protect against RSV. People over 60 who have risk factors for a severe infection, such as chronic heart or lung disease, also should get the shot. /r/n/r/n Most of the vaccines discussed above are available at your local pharmacy. Even so, check with your primary care provider before getting vaccinated. While vaccination is safe for the majority of adults, it's a good idea to check if you have an allergy or medical condition that would contraindicate certain vaccines. /r/n/r/n Your provider can also let you know if there are other vaccines you should get beyond what is listed above. /r/n/r/n Get our printable guide for your next healthcare provider's appointment to help you ask the right questions. /r/n/r/n Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.